What to expect on your third trimester of pregnancy. Finally, you have reached the last and most challenging part of your pregnancy, the third trimester. The third trimester typically starts from week 28 of pregnancy till 40 weeks or until you deliver. Now, this is the time when the baby is growing really fast, and there are a lot of changes happening in your body. But what are the things to expect during this time? Welcome to another episode of Omagy. In today's video, we will be talking in detail about the third trimester. So, buckle up, mama-to-be. What's happening to the baby? Now, let's see what's happening to the baby in the third trimester. By the end of the second trimester, the baby is almost 1 kilogram in weight. When the baby is born, which is typically at about 37 weeks, the baby weighs anything between 2.5 to 3.5 kilograms. The baby's head is actually the hardest and biggest part of their body, which tends to dilate the cervix better than the other softer parts of the baby's body. Sometimes, the baby's head could be positioned up towards the mother's chest, known as the breech position. Alternatively, the baby could be in a horizontal position, known as the transverse lie. However, typically by about 36 weeks or so, the baby settles down into a head-down position. After some time, the baby's head drops even more into the pelvis, which is referred to as lightning. The baby is actively moving inside, but initially, the movements are very erratic. It's only in the third trimester that these movements become well-coordinated and form a pattern. Good fetal movements are actually indicative of good fetal health inside. Fetal movements. So, let's talk about how to count fetal movements. For this, you should be counting the movements at the same time of the day, preferably after you've taken a meal, particularly a meal that was a little sugary. Try lying down on your left-hand side and concentrate on the movements. The movements can be simple movements, kicks, or swishes, so any kind of movement should be recorded. Note down the time when the first movement starts and then see how much time is required to reach 10 movements. It could be 30 minutes, 60 minutes, or even 2 hours. Do not worry about that. Repeat this process 3 or 4 times, and if you find any significant deviations, inform your doctor. There's another easy way to count the fetal movements. Within 1 hour after a meal, you should be experiencing a good 5 to 6 movements, or at least 10 movements within a minimum of 2 hours. Remember, if your movements are slightly fewer, please do not panic. Just inform your doctor, who might call you for a test known as the NST, or non-stress test, or an ultrasound to ensure the baby is receiving adequate blood supply. One word of caution, even excessive fetal movements or changes in the pattern of fetal movement should be brought to the notice of the doctor. For instance, if you feel that your baby is not moving the way it used to move earlier, even if the count is normal, this change in the pattern of baby movements should definitely be reported. What is happening to the mother during the third trimester? Let's talk about what's happening to the mom. Yes, this is the difficult time of pregnancy when the baby bump is very big and the abdomen, back, and legs are aching. So, here are some things you can do. Number 1, throughout the day, keep yourself active. Make sure you're wearing comfortable, low-heel platform shoes. When you're resting, especially at night, try to rest on your side, preferably the left-hand side, and you can place a big pillow between your 2 legs. Ensure that your posture is always erect. If the pain is still bothering you, you can try a little bit of hot fermentation or even take a tablet. Braxton Hicks contractions. During the third trimester, it's the time when the uterus starts experiencing little erratic contractions known as Braxton Hicks contractions. It's like the uterus is trying to prepare itself for the D-Day. The main difference between Braxton Hicks contractions and labor contractions is that Braxton Hicks contractions are typically painless and very erratic. They do not follow a specific pattern and do not intensify into strong labor pains. Importantly, there should be no bleeding or blood stains associated with these contractions. Discharge in pregnancy. So, in case you notice a discharge that is a little mucus-like and blood-stained, it could indicate that you have passed your mucus plug. However, if you notice any fresh bleeding, it could be a sign that the placenta has detached or there may be a low-lying placenta. In either case, it's important to remember that bleeding during pregnancy is never normal, and it must be reported to the doctor as soon as possible. On the other hand, a vaginal discharge in pregnancy is considered normal as long as it is clear, mucoid, and without any smell. In the third trimester, if you suddenly notice a very thin, watery discharge, it could indicate that your water has broken. The baby is enclosed in an amniotic sac, and if that sac ruptures, there may be a sudden leakage of clear, watery discharge. If this happens, put on a clean pad and start packing your things to reach the hospital. Additionally, it's very normal to experience frequent urination in the third trimester. This means that each time you cough, sneeze, or even laugh, you may dribble a few drops of urine. This is because the baby's head descends down, exerting pressure on the urinary bladder. However, if the frequent urination is accompanied by pain or fever, it could be a sign of a urinary tract infection, UTI. Varicose veins. In the third trimester, the veins, specifically the varicose veins, become very prominent. This occurs because the enlarged uterus blocks the blood flow from the lower legs back to the heart, causing blood to accumulate in the veins. As a result, the superficial veins in the lower legs become swollen and appear bluish or purplish. There is also often associated swelling in the legs. These changes are normal during pregnancy. To alleviate discomfort, ensure that you wear comfortable clothing while walking and elevate your legs when sitting. It's also a good idea to slightly reduce your intake of added salt in your diet. If you experience excessive swelling, it's advisable to avoid pickles and chutneys. However, the normal salt used in day-to-day cooking is perfectly fine to consume. Colostrum. During the third trimester, changes occur in the breasts. They may become slightly larger and more sensitive. You may also notice that the areola, the darker area around the nipple, becomes bigger and darker, and there may be stretch marks around the breast tissue. You may observe a sticky, yellowish liquid coming out from your nipples. This is called colostrum. It's important not to worry if your breasts leak colostrum on their own. Simply wipe it off. There's no need to squeeze or press them. Doctor visits. During the third trimester, the frequency of doctor's visits increases. Usually, from 28 weeks to 36 weeks, patients are called in for visits every 2 weeks. After 36 weeks, the visits become weekly. For first pregnancies, doctors often perform an internal checkup around 37 or 38 weeks. This is known as a pelvic assessment, where they examine the bony pelvis to determine if the baby can pass through it during delivery. Red flags. Let's understand what the red flag signs are, indicating when it's time to rush to the hospital. If you're experiencing pain that starts from the back and moves to the front, increasing in severity and frequency, it's important to seek medical attention promptly. Continuous pain in the lower abdomen is another sign that requires immediate attention. Any leaking of clear watery discharge from the vagina or any bleeding should also be reported to the hospital. Excessive nausea or vomiting, severe headache, fever, significant changes in the pattern of baby movements, pain during urination, or frequent urination are all red flags that warrant medical evaluation. And those are what to expect on the third trimester of pregnancy. Do you have any questions? Feel free to write them down in the comment section below. Please like and subscribe. Once again, this is Amaji. Thank you for watching, and we will see you in the next video.